tomorrow morning when you wake up, before you brush your teeth, before you make coffee, before you do anything else, I want you to look in the mirror because your face is showing you something right now that your heart desperately needs you to see. Not a dramatic sign, not something obvious, a subtle change. Something most people look at every single morning and never recognize for what it actually is. A warning from your heart. I have been practicing cardiology for 23 years, and the face signs I am about to show you are taught in every medical school in the world. Physicians are trained to recognize them in seconds, but almost no senior has ever been told what to look for in their own mirror. In this video, I will show you 7 specific face signs that indicate your heart is in danger, what each one looks like, why it appears, and exactly what to do when you see it. Look carefully at your face as I describe each sign, because what you find in the next 13 minutes could be the most important thing you discover this year. Tell me in the comments, when did you last really look at your face for health signs? Type your answer below. Before the 7 signs, you need to understand why the face reveals heart health at all. Your face has the densest concentration of blood vessels of any external surface on your body. Thousands of tiny capillaries sit extremely close to the surface, making the face the most visible window into your circulatory system available without any medical equipment. When your heart is pumping efficiently, delivering oxygenated blood through healthy, flexible vessels, your face reflects that health in its color, its symmetry, and its tissue quality. When your heart is struggling, when vessels are narrowed, when circulation is compromised, when the heart muscle is under stress, your face shows the consequences of that struggle in specific, documentable, medically recognized ways. 3 mechanisms connect heart health to face appearance. First, reduced circulation. When the heart pumps less efficiently, blood flow to peripheral areas, including the face, decreases. Tissues become oxygen deprived. Color changes occur. Second, fluid accumulation. When the heart cannot move blood forward efficiently, fluid backs up and accumulates in tissues, including the soft tissues of the face. Third, oxygen deprivation. When circulation is compromised, the body prioritizes oxygen delivery to vital organs, reducing it to peripheral tissues, including the skin. The result is visible changes in color, texture, and tissue quality. A study published in the European Heart Journal found that trained cardiologists could identify patients with significant cardiovascular disease from facial photographs alone with accuracy significantly above chance, demonstrating that the face genuinely contains readable cardiovascular health information. Now the 7 signs. Please look at your face as I describe each one. Warning sign 1. Blue or purple lips. Look at your lips right now. What color are they? Healthy lips should be pink to red, reflecting the oxygenated blood circulating through the dense capillary network just beneath the surface. Blue or purple lips, a condition called cyanosis, indicate that your blood is not carrying adequate oxygen. The hemoglobin in your blood that has released its oxygen turns a darker blue-purple color rather than the bright red of oxygenated blood. When enough deoxygenated blood circulates in the capillaries near the surface, the lips take on a bluish or purple hue. In seniors, this can indicate several serious cardiac conditions. Heart failure, where the heart cannot pump blood efficiently enough to maintain adequate oxygenation. Severe peripheral arterial disease, where narrowed vessels reduce oxygen delivery. Or a serious cardiac arrhythmia, where irregular heart rhythm compromises pumping efficiency. A study published in the American Journal of Emergency Medicine found that lip cyanosis in adults over 65 was associated with clinically significant cardiovascular compromise in over 60% of cases when formally investigated, if your lips appear bluish or purple, particularly if this is a change from their normal color. This requires emergency evaluation. If the cyanosis appeared suddenly and is accompanied by shortness of breath or chest discomfort, call emergency services immediately. Warning sign 2. Earlobe crease. Look at your earlobes now. Run your finger along the bottom edge of each earlobe. Do you see or feel a diagonal crease? A line running from the front of the earlobe toward the back at roughly a 45-degree angle? This is called Frank's sign, named after cardiologist Sanders Frank, who first documented its cardiac significance in 1973. And it is one of the most extensively studied and most consistently validated external signs of cardiovascular disease in medical literature. A diagonal earlobe crease, particularly when present on both ears, has been associated with coronary artery disease in over 40 published studies spanning 5 decades of research. The proposed mechanism involves the same small blood vessel disease that affects coronary arteries, also affecting the capillaries supplying the earlobe, causing subtle tissue changes that produce the characteristic crease. A meta-analysis published in the American Journal of Medicine examined data from over 520 patients and found that diagonal earlobe crease was associated with a significantly higher rate of coronary artery disease compared to those without the crease, with the association strengthening when the crease was bilateral and deep. This sign does not mean you are having a heart attack. It means your risk of coronary artery disease is significantly elevated, and that a cardiovascular risk assessment with your physician is urgently warranted if you have not had one recently. Feel your earlobes now. If you find a diagonal crease on one or both sides, mention this specifically to your physician at your next appointment and request a cardiovascular risk assessment. Warning sign 3. Yellow deposits around eyes. Xanthelasma. Look at the skin around your eyes, particularly the inner corners of your upper and lower eyelids. Do you see any yellowish, slightly raised, flat deposits? Patches that look like yellow wax or cream just beneath the skin surface? These deposits are called xanthelasma, and they are composed of cholesterol-laden immune cells called foam cells that have accumulated beneath the skin surface. Xanthelasma indicates that cholesterol is being deposited in soft tissues, a sign of disrupted lipid metabolism that directly mirrors what is happening in your arterial walls. The same process that creates xanthelasma around your eyes is creating arterial plaque inside your coronary arteries. A study published in the British Medical Journal followed over 12,000 adults for 33 years and found that the presence of xanthelasma was associated with a 48% higher risk of heart attack, a 39% higher risk of heart disease, and a 14% higher risk of stroke, independent of measured cholesterol levels. This last finding is particularly significant. The association held even in people with normal cholesterol blood tests, suggesting that xanthelasma indicates cholesterol metabolism problems that standard lipid panels may miss. If you notice any yellowish deposits around your eyes, even small ones, bring this to your physician's attention immediately and request a comprehensive lipid panel, including LDL particle size. Warning sign 4, facial flushing or persistent redness. Look at your cheeks, nose, and forehead. Is there persistent redness? Not the healthy pink of good circulation, but a deeper, more persistent flush that remains even when you are not warm, not embarrassed, and not physically active. Persistent facial flushing in seniors can indicate several cardiovascular concerns: uncontrolled high blood pressure, hypertension, increases blood pressure in the facial capillaries, producing persistent flushing particularly across the cheeks and nose. This is not the reliable sign that many people believe. Blood pressure cannot be accurately estimated from face color alone, but persistent unexplained facial redness in a senior who has not had their blood pressure checked recently warrants measurement. More specifically, a butterfly-shaped redness across the cheeks and nose can indicate systemic lupus erythematosus, an autoimmune condition that directly attacks heart tissue and significantly elevates cardiovascular risk. And rosacea, a common skin condition producing persistent facial redness, has been shown in multiple studies to be associated with elevated cardiovascular risk. A study from Stanford University found that rosacea patients had significantly higher rates of high blood pressure, high cholesterol, and coronary artery disease compared to age-matched controls, suggesting shared vascular inflammatory mechanisms. Persistent unexplained facial redness in a senior over 65 warrants a physician evaluation that includes blood pressure measurement, inflammatory markers, and a review of cardiovascular risk factors. Warning sign 5, facial asymmetry, one side different from the other. Look at your face straight on in a mirror. Now smile. Is one side of your face moving differently from the other? Is one eyebrow slightly lower? Does one side of your mouth drop when you speak? Sudden facial asymmetry, particularly asymmetry that is new and appeared recently, is one of the most urgent emergency warning signs in all of medicine. It is the F in the BE Fast Stroke Recognition acronym, face drooping. During a stroke, or TIA, transient ischemic attack, blood flow to the brain regions controlling facial movement is disrupted. The facial muscles supplied by the affected brain regions stop receiving neural signals. The face droops on the affected side. This asymmetry may be subtle initially. A slight difference in the depth of the smile on each side. One eye that does not close as completely as the other. One corner of the mouth that sits fractionally lower than the other. If you notice sudden facial asymmetry, particularly combined with any arm weakness, speech difficulty, or vision changes, call emergency services immediately. Do not drive yourself to the hospital. Every minute of delay in stroke treatment costs 1.9 million brain cells. Even if the asymmetry resolves within minutes, as in a TIA, call emergency services. A TIA is a final warning of an impending major stroke. The 48-hour risk of major stroke following a TIA is approximately 10%. Immediate treatment reduces that risk by 80%. Warning sign 6, gray or pale complexion. Look at the overall tone of your face. Not in comparison to others, but in comparison to your own normal color. Has your complexion become noticeably paler or grayer than it usually is? A gray or ashen facial complexion, particularly when it is a change from your normal color, can indicate that your heart is not pumping blood efficiently enough to maintain adequate peripheral perfusion. During heart failure or severe cardiac compromise, the body prioritizes blood flow to vital organs, brain, kidneys, liver, by reducing it to peripheral areas, including the skin. The face loses its normal color. It appears pale, gray, or washed out. The skin may feel cool and clammy to the touch. This gray complexion, combined with any fatigue, breathlessness, or swelling in the legs, is a classic presentation of decompensating heart failure, a medical emergency requiring immediate evaluation. Even without these additional symptoms, a persistent unexplained change to a grayer or paler complexion in a senior over 65 warrants a physician appointment this week and a cardiac function assessment, including an echocardiogram. Warning sign 7, swelling around the eyes, periorbital edema. Look at the skin directly beneath your eyes. Press gently with one finger below your eye on the upper cheek. When you release, does the indentation remain for a moment before the skin returns to normal? Swelling around the eyes, periorbital edema, that is present in the morning and reduces through the day, is a specific pattern that indicates fluid accumulation during overnight recumbency. In seniors, this morning predominant facial swelling can indicate heart failure, where the heart's reduced pumping efficiency allows fluid to accumulate in tissues overnight when the body is horizontal. It can indicate kidney disease, where reduced filtration allows fluid retention throughout the body. Or it can indicate low albumin from liver disease, where reduced protein production allows fluid to leak from blood vessels into surrounding tissue. Morning facial swelling that leaves a pitting indentation when pressed, the same pitting test I described in the foot warning signs video, is a sign that deserves physician evaluation this week with cardiac function testing, kidney function, blood work, and liver function assessment. 3 response levels based on what you found. Call emergency services immediately. Sudden blue or purple lips appearing now. Sudden facial asymmetry, drooping on one side, gray ashen complexion with breathlessness or chest discomfort, any sudden facial change accompanied by arm weakness or speech difficulty. Physician appointment this week, diagonal earlobe crease on one or both sides, yellow deposits around eyes, persistent unexplained gray or pale complexion, morning facial swelling that pits when pressed, persistent unexplained facial redness, mention at next appointment, mild redness across cheeks that has been present for some time, very slight earlobe crease, minor color changes that may be lighting related. 4 steps, starting tomorrow morning. Action step 1. Tomorrow morning, look in the mirror in good natural light. Check for all 7 signs: lip color, earlobe crease, yellow deposits around eyes, facial redness, asymmetry when smiling, overall complexion color, under eye swelling. Write down anything you notice. Action step 2. Make this 60-second face check your daily morning habit. Changes that develop gradually are easier to catch when you look consistently. A change you notice immediately is infinitely more treatable than one you discover months later. Action step 3. If you notice the yellow earlobe deposits or earlobe crease, request a comprehensive cardiovascular risk assessment at your next physician appointment. These signs do not require emergency care, but they do require formal cardiac evaluation that many seniors have never had. Action step 4. Share this video with your family today. Ask them to look at your face. Ask them to look at their own. Because the people who see our faces most frequently are the ones most likely to notice gradual changes that we stop seeing ourselves. Your face has been with you your entire life. You have looked at it in the mirror thousands of times, and every single morning, it has been showing you information about what is happening inside your heart. Now you know how to read it. 7 signs, visible in any mirror, available to check every single morning before the day begins. Signs that your cardiologist looks for, that your physician is trained to recognize, that you now know how to find yourself. Look tomorrow morning. Look the morning after. Make this 60-second check as natural as brushing your teeth. Because the earliest sign of heart disease is not a chest pain. It is not a hospital test. It is a reflection in your own mirror that has been trying to tell you something for longer than you realize. Subscribe for more senior-specific, genuinely life-saving health information every week. Hit the like button if this made you look at your face differently. Leave a comment. Which of these 7 signs will you check for first tomorrow morning? Thank you for watching. Look in the mirror tomorrow. Your heart is already looking back.